autoimmunity basically just means your own immune system's response against yourself. It begins as a slow physiological response where the immune system will create antibodies to any molecule it considers to be a foreigner. With frequent exposure to the foreigner, these antibodies begin attacking both the foreigner and normal body tissue, which has a similar structure. Eventually, the immune system cannot differentiate between the foreigner and the normal tissue, which then leads to pathologic dysfunction and injury. So what happens is that when one is exposed to that foreigner, usually it's primarily from ingestion, because the biggest source of exposure to our body is usually by mouth, and it's typically from what we consume in our drinks or beverages. And what happens is that the signal is going to your stomach and to your small intestines. So then those organs say, hey, there's something wrong. So they send a stress signal directly to the midsection of your brain. So that's primarily your hypothalamus and your pituitary. And that sends off different signals to, for example, your pancreas. Because when you get a stress response, your body's told you need to produce a lot more sugar, and I need immediate energy. So the pancreas says, hey, I'm going to release insulin because we got all this sugar in the bloodstream. And then it tells the fat in the liver, hey, we can't do fat metabolism, we got to do glucose metabolism. So fat, go into storage, right? We need immediate energy. The problem is in this triad, when you're just producing that sugar, you got to produce a lot of sugar, because one sugar molecule is only it produces 3 ATP, that's energy, right? The fat produces a lot, but in that emergency, you're like, I need a lot. Now the other thing that happens is that the hypothalamus also sends a hormone called cortisol releasing hormone to the pituitary. And the pituitary then releases a hormone called ACTH, which then tells the adrenal glands that are sitting right on top of your kidneys, I need you to produce cortisol because we've got an emergency. So what happens then, cortisol is this beautiful hormone that you produce it when there's an emergency. And the body says, okay, once the emergency is over, we're good to go. So what cortisol does is says, okay, for me to do my job, I need to shut down normal functions because they're going to get in my way. Because we got to fight or we're going to run. So one of the normal functions it shuts down is it tells the brain that you need to tell the thyroid gland not to produce active thyroid hormone, right? Because if we do that, then you're going to tell the digestion to do its job, you're going to want to lubricate the skin, you're going to want to tell your immune system to really react. But you need to shut that down. So that way you can do that, rapid breathing and tell the heart you need to not relax the heart muscle as long so you can really just get enough oxygen and run. The problem is that when there is this stress signal where cortisol is being told to be produced again and again and again, then what happens is this becomes dysfunctional. Because if you keep telling, say, the thyroid hormone, you need to stop producing active thyroid, then we're going to have problems. So what happens is that it's that regular exposure to those different triggers. Because typically what happens is when you ingest something, your stomach kind of says, ooh, I don't like this thing. So it'll kind of try to tell you, hey, I don't want this. But over time, it gets tired. And it just says, I can't. So it kind of lets it go to the small intestines. Now the small intestines is a very critical part of our digestive tract because it is where a lot of the key absorption happens. So all those beautiful foods and waters that we need, they get absorbed primarily in the small intestines. And it's only one cell wall thick. Unlike in your stomach and in your large intestines, it's many cell walls thick, right? Because it's this thick wall that needs to hold on to things. But your small intestines, because it's one cell wall thick, if the system gets insulted again and again and again, what happens is there's these tight junctions, they get broken. And when they get broken, then things start seeping through. And when they seep through on the other side into the bloodstream, then the immune system creates this complex. So it forms these antibodies and it starts to attack those things. And now it creates like this inflammatory reaction throughout the body. Now if this happens again and again, then it really does lead to poor health. So the thing is that we want to figure out what is it that's making these junctions get broken, what's damaging these cells. Because if we figure that out and we're not sending off those triggers, we can reverse this entire complex because it's meant to completely repair. So what's happening is that this is how we've led to like over 100 different diagnoses of autoimmune disorders, right? So you can say from the brain, if you're getting this like frequent fight or flight reaction where the brain is getting clogged up with all these toxins and not getting proper oxygenation, we can call it autism in children, to ADD, to dementia, to multiple sclerosis. For the thyroid, which starts getting attacked, we can call that thyroiditis, which means inflammation of the thyroid, or Hashimoto's thyroiditis, Graves' disease. To the bones and the muscles, we can say, hey, the joints are getting eaten away, so we can call that rheumatoid arthritis, or lupus, to ankylosing spondylitis, to dermatomyositis, the skin. If the skin doesn't get properly hydrated and it gets really dry, then it starts creating a thicker tissue, and we can call that eczema or psoriasis. We even call it like the skin pigmentation changes, and we call it vitiligo. Or it gets really thick and dry, itchy, and they even call it scleroderma. To the lungs, which really can't properly oxygenate, and we can call that, reactive airway disease. To granulomatosis. So there's so many different names. And what we do here is we break it all up into all these different systems and all these different names, so we all get kind of confused because we're like, how did this whole thing start? Right? And now, over the years, we've come up with more and more diagnoses, but we're not understanding how did this whole thing start. Right? And so there's from Crohn's to peripheral neuritis to leukemia, lymphoma, breast cancer. They're all tied to our own immune system that's attacking us. And it's meant to take care of us. So all we're going to do is figure out how do we turn this around. What we're seeing is all of these chronic diseases, they're really first world problems, and there's a huge epidemic. A lot of this started to really accelerate in 1975, because that is when, you know what happened in 1975? No.
Something?
So Roundup came out into the market in 1975. Roundup was used as a weed killer, right? So we used it to spray a lot of weed because we thought weeds are the problem in agriculture. And if we kill all the weeds, then we're going to have beautiful foods. So we started to see a rise in autoimmune disorders, but it really did not make its heyday until 1996. You know what happened in 1996? Okay. 1996 is when genetically modified crops that are Roundup ready were introduced into agriculture. Because we thought, oh, the weeds are the problem. So if we kill the weeds and then we spray everything, and we've got these crops that can grow beautiful food, then we can feed the world. But the problem is that we decimate our soil. So the soil doesn't have any more nutrients in it, right? And our soil is just these beautiful microorganisms that are critical for how then beautiful food is grown. But what we've done is we keep spraying them, and every year we start this, we need to spray more and more, and the soil completely has gotten decimated. And what happened is then as that has increased, it has shown a direct rise in all the autoimmune disorders. Because just like the soil of the earth, we are like the earth, where we are full of lots of beautiful bugs, right? We're more bugs than we are any other cell. And so when all of that gets messed up and it doesn't get nourished, then we've seen that we actually have more disease as our food sources quality has gone down, and we spend less on food than we used to as a country, but we have more pathology, and we spend way, way more in healthcare than we did before 1970. So what it's shown actually today, that 1 in 36 kids have autism. And by 2035, that's 1 in 3. 1 in 10 kids have attention deficit disorder, 70% are medicated. So it's more than 25% of kids. 1 in 4 have diabetes. 1 in 3 are obese. 1 in 2 have major psychiatric issues. They're just really sad, and they don't feel like they have any hope. 1 in 2 have cancer. And basically, most people, by the time they're 25, have some level of cognitive decline. So this is not just the United States. I mean, this is like, you can see this throughout many different parts of the world. And what we're seeing is in that past 30 years, so almost when this rise started, of how we've started changing agriculture, we've actually seen a 50 to 60% drop in sperm count. So the way we're going is that by the time my kids are my age, like, we can't sustain our population because the infertility is just going to go like this. This is a big problem. And this really only happened since I was born, right? So we got to change this. The key is that the number one stressor is stress. Oh, I don't know how to fix this. Okay, here we go. It's honestly the way we think. Because if you are a crazy happy person all the time, you really can't ever get sick. And the biggest thing I want you to take away is that just know that you are enough. It is actually this like constant conversation people have in their mind where they think. And it leads to this like conversation of I'm not enough, to I'm guilty, I'm really scared. So it's kind of like they got to think a lot because they're like, did I make the right choice? Did I do this? Oh, am I late all the time? That conversation, what it actually does physiologically is it sends a signal to the heart because the brain says, hey, there's an emergency. So the heart says, okay, I need to relax for shorter time. So a heart muscle should relax for about 0.5 seconds. It now starts to relax at 0.4 seconds or 0.3 seconds. When you do that, what happens? The blood does not get 100% oxygenated. Because only during relaxation does blood get oxygenated. So if it doesn't get adequately oxygenated, then you're not going to get adequate oxygen delivered to all of your cells of your body. You're just going to be in this like heart beats really fast, think from the midbrain, and then after a while, no repair work is happening. So it literally comes with having this trust in oneself. And it has to do with feeling like you're connected to more than just yourself. You've got a community and you keep investing in that. That's the biggest game changer that protects people. You know, it takes the I in illness, which is I, isolation, and you change it to the W in we and wellness. That is the biggest thing. The other biggest thing is this idea that, you know, when I'm done doing everything, then I'll go to sleep. Well, we're never done doing anything, and we have a lot of distractions. And what happens is that repair only happens when we sleep. So when we kind of say, oh, I'll sleep later, we just don't catch up, right? So we actually start creating more antibodies, and our system feels more in panic. So we can't like fix the situation. So that stillness of being boring and just being instead of doing is a big game changer. The other is just electronics. So we live in a world where it's so easy to like pick up our phone. Our alarm is our alarm clock, and our phone is there, our iPad's there. It's so easy, and the minute that we see that information, we go. But it actually sends a signal to our brain that it says you're in a deficit because you're getting this like intermittent dopamine like boost. But what happens is that also messes with cortisol production. So it actually doesn't let us shut down. Even though we think we're just passively like, you know, watching TV and we're relaxing, it actually, that constant like a little bit of dopamine, it screws up with the cortisol. And then just, you know, in terms of noise and light pollution, I mean, there's definitely like overstimulating factors. In terms of diet, that is something that one can just start having some awareness about where is your food source coming from. So I talked about Roundup. Roundup is used heavily in agriculture, in gardening, throughout farming, not just in the United States, but definitely worldwide. So the biggest things you want to think about is any food that requires a lot of water for production. If it does, it needs a lot of resources. It is going to get sprayed heavily. So number one is your genetically modified crops, which are primarily corn, soy, and wheat. The seeds are 99.9%. They're modified and they're sprayed. So it's not just that it's organic. The problem is the seed itself, we can't recognize it. So our own gut microbiome says, I don't like this thing. So you think about that, but remember that for corn, 40% of corn production is for ethanol. And 40% is actually for cow feed and for animal feed. So only 20% is for humans. So that 80% people are getting it in food sources that they never even think about. But most of the GMO crops are really for animal feed. So even if you say that I don't have those crops, if you consume different types of animal feed, or animal products like dairy, red meat, chicken, poultry, you're just going to get a lot of pesticide-sprayed foods, the way it is. I talked about alcohol, partly because of the GMO crops, but also alcohol does get sprayed very heavily, and it does have high levels of mycotoxins and mold. The alcohol industry has no regulations. So people, if you ever meet them from the wine industry, they'll actually tell you, like, it's not as clean as even like maybe your tap water is, because they don't necessarily use the same water for the wine industry, for example, that you would get from your tap water. Cacao beans, because those are grown in the rainforest, so they travel thousands of miles to get to our doorstep. And what happens is they have to spray them a lot because they do get moldy. The other thing is the cacao beans for your coffee or your chocolate. They're very dehydrating because they're diuretics, so they make us pee more, but they also make us lose all our water-soluble vitamins, which are our antioxidants. And I'm not saying any of these items are terrible, but it's when you're like, your staples of your diet is these main items. They're not rich in nutrients and oxygen. And the soil, when they're growing these items, it's like almost cement. You know, so it doesn't have those really beautiful microbiomes in there. It's just this like sprayed, plowed fields that are getting sprayed more and more. So the way you're going to turn this upside down is just think about, if I talk about soil, think about you're kind of like a garden, and you nourish yourself with whole foods, like plant-based foods. Anything that grows above like the earth is full of lots of nutrients. And really think about getting organic when you can, because there's a lot of work and lobbying that's been done to try to actually get more and more awareness on organic. So the label will say USDA organic. But the movement now that the farming industry, which really those few farmers that are left, we're trying to save in terms of, because they have the highest rate of suicide in the world because of their lands taken away, they're told how to grow their foods. They're actually trying to change how farming is done. And so the movement has been to create USDA organic regenerative. So regenerative means it's not just about the actual organic, it's about how is this food grown? Is it coming from sources where we're sustaining the lives of our farmers and creating really nourishing food? You also think about water hydration. So just drinking water, it doesn't always mean it's acidic or it's alkaline, right? So when I say sufficient alkaline hydration, it means water, like not out of plastic bottles, right? Water just from your tap is still relatively okay. Then even like when you hear about all the lead in the water, we get way more lead from many of these food sources than we do from our lead, or from our water. So when I say water, it's like wake up in the morning and have like 3 or 4 glasses of water. And when you drink water, be really conscious of drinking the water. Instead of drink and you're like doing lots of things and you're drinking and you're eating, it like puts our system to panic because it's not designed to multitask, right? So a simple thing is drink from a non-plastic container because it will allow the water to be more alkaline, have it more room temperature than cold, because it allows the water to get immersed into the cells and get rejected. Mindfulness of eating is really critical. You know, we're not even connected with how our food is grown, but now we live in a world where people aren't even conscious of how the food is made, and they're not even conscious sometimes of eating and what else they're doing. So that messaging says like, oh, I really love eating, but I want to like multitask, or I want to do it later. So it's just, all I'm saying is when you show up for the experience, you tell your system that you're really fine, right? And that plays into intermittent fasting, which is that fasting is actually really critical for starting to like let intensive repair work happen, especially at night, where your body's not designed to constantly be fed, because when you eat it, it needs time to go through the entire digestive tract. So when you have periods where you're just giving it a break, it actually will do intensive like repair work. So I usually will say if you could fast at night, like don't eat right before bed, you know, wait a couple hours. If you wake up and you're really not hungry, that's fine, but just don't wait until you're hungry to eat, because you might be ravenous and engage with food in a way that's not mindful. But intermittent fasting is really, it's a way that people have lived for most of mankind. They never ate 3 times a day, they once or twice, and they have true sustainability because many foods, they break down at different rates. And so we want periods when we can actually have nothing that's here, so we can start burning the fat that's in storage, and we actually get more energy. Other causes is actually drugs. So antibiotics, the biggest exposure to antibiotics is just, it's predominantly used in the animal industry. It's heavily given to in animal feed because most animals are getting different crops and things that do make them sick. There's a lot of factors that causes them to get sick. So our biggest exposure is actually just in our food sources versus just taking antibiotics. And remember, antibiotics is the concept is that we have to clean out all the bugs, but in reality, it's actually led to a lot more inflammatory problems because we need that healthy microbiome. We don't want to completely blast it. NSAIDs, so anti-inflammatories, pain medications, gelatin-coated pills, the bovine or collagen extracts, a lot of different pharmaceutical drugs. Again, it's not like they're totally like a bad thing, but what's happening is we've gone from the acute management where they were useful to chronic management, and they start to create a lot of dysfunction, and we're not able to then address the actual underlying problem that's going on. And also then for people who've just had a compromised immune system, so they've had a lot of different medications in their lifetime, maybe a kid who was a C-section baby, a kid who wasn't necessarily breastfed. Again, you can recover from all of these things, but if there's just a constant insult that's happening, it's harder to recover over time. If you've been in the hospital a lot, there are other exposures people are getting exposed to. Right? But again, these are all things that we can kind of address. And a lot of it has to just do with how do we do more restorative health, where we really go back to looking at the whole person. How do we detoxify? So do less harm. How do we use the original philosophy of medicine, which was food is medicine, to actually take care of a whole person? Other toxins can be basically how things are packaged. So a lot of the plastics that cover our foods or beverages, those are like derived from gasoline. So what happens is it actually changes the molecular structure of the food, so it doesn't make it as nourishing. So it's just kind of more consciousness that sometimes we look at the actual labeling the food, but we forget what the package is. And the package is also really important in terms of like, does it bring this food to life or does it make it less alive? Part of it is like, there's microwaving our food to when we cook food at really high temperatures. It's about how we change the molecular structure of the food. And so now, you can't get the nutrients out because we cooked it at a really high temperature, like grilling it and roasting it to microwaving it, because it's fast and we think it's efficient. But we change the nourishment of the food. So we have to eat more, but we don't feel like as alive. So it's just more consciousness around some of these concepts, right? It's not you gotta do it all. It's really about focusing on the big picture. And the reality is that every person is unique. And so their situation is unique. And the key is that we design the treatment to be just right for each person. Because one thing works best for you versus for you or for you. And it's finding just that one or two things and not feeling overwhelmed. So what I'm going to do is actually just present a couple cases. The first one is a patient who came in with Crohn's disease. This is a 42-year-old woman who had recurrent bowel obstructions and digestive problems, who required extensive hospitalization. She was a self-employed lawyer who had a crazy workload. She had really limited social support. She had a tendency to eat out often. She didn't have time to cook. She didn't have that much time to take care of herself. She lived on caffeine and she relaxed with alcohol. And she would always try to get all her work done before she'd go to bed. So she never really got a lot of sleep. And what we found out through talking to her, looking at all of her past medical history, to her blood and urine tests, is that she had irritable bowel syndrome, fatty liver, chronic gut infections, leaky gut, heavy metal and toxin poisoning. Her thyroid wasn't working well. She had all these nodules. That sounded really alarming, right? And she'd been in the hospital so many times and been on so many different antibiotics for her Crohn's disease. She was really immunocompromised. And so I had to take a different approach, where I had to first start with just kindness, because she really was just scared. And one of the things we did was we said, okay, how do we nourish you? Because when you eat, you feel awful. So you don't even want to eat. So we've got to turn this around and make it safe. And so what we did was we talked about how do we have an alkaline diet that you can actually digest. But in the beginning, we had to start with just a liquid diet, because she couldn't digest food anymore. And so we did take out some key acidic items. We took out sugar, flour, bread, and animal protein. We also I started her on Physician's Elemental Powder from Integrative Therapeutics, because it gave her all of her nutrients that were active. It also gave her all her antioxidants, her good fats, and all of her amino acids, so her cells could get nourished and she could rest her gut. I also gave her more support for her gut, things to help her sleep, and how do I detox her? Like use magnesium, use turmeric, teach her that it's safe to fast, teach her how she could have consciousness and breath. And what we found in this patient is that literally within like weeks, she didn't have severe abdominal pain anymore. She felt calmer. She was actually like able to sleep more hours than she was sleeping before. And she started to have hope. And what we saw in her labs is that a lot of her inflammatory markers started coming down. Right? And she was actually starting, after a few weeks, we could start introducing more variety of foods, and she felt safer to eat. So it was that like, yes, we got her out of that really crazy acute zone where she kept going going in and out of the hospital, and we got her away from it. And then months later, she was, eating really well. But I think the big thing that changed was she also started addressing that she didn't really like her job. She needed to figure out what the heck was making her so miserable. She had to expand her community, right? And when you look at her labs, the whole story changed. The second case we're going to look at is a woman with Hashimoto's thyroiditis and breast cancer. She's a 46-year-old woman who presented with chronic Lyme of 10 years. She was coming in with severe heart palpitations every night, chest pain, low blood pressure, and fatigue. Now this woman had been caring for two really ill sons with chronic infections for years. She was under an intense amount of stress. Her marriage had not been going well for like 20 years. And she didn't have time to take care of herself. So she would just numb her emotional exhaustion with sedatives, to just not able to make good food choices. She would like escape with like on her smartphone. Through her history, her physical exam, her blood and urine tests, and we did a thermography, we actually found that she had really severe leaky gut. She did have a lot of chronic infections, and she'd been on so many antibiotics. Her liver was actually really congested and damaged because she'd been on anxiolytics for a long time. She was getting exposed to a lot of different toxins. Her adrenals were like shot. And she had really severe Hashimoto's, probably the worst case, where they couldn't even measure how high the antibodies were because she was past their maximum level that they measure. And when she did a full body thermography, which is a digital thermal imaging, so you're actually trying to detect how does her mitochondria of her cells function. So the powerhouses, are they actually producing a lot of energy, or are they producing a lot of inflammation and free radicals? When we did the scan, we actually saw that she had stage 1 to 2 breast cancer, which was then confirmed with an ultrasound. And remember, she never presented with any breast symptoms. She had really dense breasts. So she was also somebody I was worried about doing a mammogram because that radiation would just get her more compromised. So after we got the results of the thermography, she actually went to see one of the world's top oncologists who actually told her that traditional breast cancer treatments are not advised because it would actually increase her risk of malignancy. So like from surgery to chemotherapy, radiation, hormones, it would actually make things much worse, and you don't recommend that with the stage 1s to 2 breast cancers at this point. But it is really critical to address the root cause of her illness, which is her crazy level of stress. And she's full of so much self-doubt and self-neglect. When this woman, for the first time, realized, I might not be here in 24 months, and I really have to take care of these boys, it was like this light bulb went off for her. And she actually was like, I have to take care of myself. It's not a choice anymore, I have to. And what happened was, is she actually started investing in heavily into family and self-therapy. She started to learning about mindful breathing and relaxation. She definitely changed her diet. She actually started drinking water when she should drink water. She started to switch to a much more whole foods, plant-based, organic diet. So we took out the animal feed, animal protein, the GMO crops, the alcohol, the processed foods that seemed to be easy, but they were actually making her more and more tired. And we started to say, you know what? No matter how much you have going on, you gotta like sleep, and you've gotta like do this because you're setting an example for your boys, right? Who are up to like 10, 12, because they're like 16-year-old teenagers. And I said, you've got to do this for yourself. And literally, within like weeks, she just started to like calm down a little. The cortisol started coming down. And what we saw is when we repeated the thermography 3 months later, she actually had shrinkage of some of her breast tumor. So it was still there, but it was getting smaller because it was in that like pre-cancer to stage 1 where you could either go this way, because usually you never detect this on those scans, or we could maybe turn it around because we weren't trying to feed those cancer cells. And her antibodies for her thyroid started to just start coming down. Her liver was working better. She was getting more nutrients. And the biggest thing that happened is that she had hope. And when she had hope, her kids started getting better. So the story does have like a good ending. That yes, we didn't like, the cancer hasn't totally gone away. There's a lot of work that needs to be done. But the fact that this woman knows that she can do something about it, that's how we reverse autoimmunity.